So the EORTC Lung Cancer Group is one of the biggest ones at the European Organization for the Research and Treatment of Cancer. And indeed, last year we had quite a changes. We changed the board, so now the chair is Jordi Ramon from France, and the secretary is Liz Hendricks from the Netherlands, and I became the treasurer, the girl with the money. So we also have now, because we have a very active group with over 800 people, and a third of them are young and early career investigators, which are a very dynamic force. We decided to create this young and early career investigator board of coordinators. So we also have people for the communication, education, and also translational research. So in terms of the ongoing trials that we have, so currently we have the PRIMALung trial, which is an academic trial looking at in patients with limited stage or extensive stage small cell lung cancer after induction treatment. If they don't have any brain mets and they are not progressing, they are randomized between prophylactic cranial irradiation versus brain MRI surveillance. And the objective here is to prove that brain MRI surveillance is non-inferior to PCI, and it's actually better in terms of quality of life and so on. The principal investigator of this trial is Corinne Feverfin from Manchester, and there are a lot of UK sites open. So it's a very important academic question that we have, and I hope that here in the UK people are motivated to include a lot of patients in this trial. Then we also have the ICARUS trial, which is in a oligometastatic setting. Patients receive the chemo immunotherapy, and then they receive local ablative treatment, either radiotherapy and or surgery to all visible lesions. And then they are randomized between semiplimab, so continuing immunotherapy, versus stop everything. And the objective here is to prove that continuing immunotherapy is better in terms of survival. So this trial is ongoing. Unfortunately, it's not open in the UK, but it's open in other European countries. And finally, we also have the BioRadon, which is an observational study in which we give radon detectors to patients in order to understand if this might be associated with occurrence of non-small cell lung cancer with specific mutations or gene fusions, and this is also ongoing. But we have a lot of other trials in development, so that I cannot, because they're still confidential, that are probably going to open up during 2026, so next year I'm sure that we'll give more details. And then just to conclude, we have also, we also presented the data from the NIVOTHYM trial last year at ASCO, which is done with ETOP, and we presented the data for the cohort 2 of patients with thymoma and thymic carcinoma pre-treated with platinum-based chemo, and they received nivolumab and ipilimumab. Unfortunately, it was a negative trial because the PFS at 6 months was around 20%, way below the 40% that we thought. But still, it's a very niche population with we don't have many treatment options, so it was a very nice trial. And we have some patients, I have personally some patients that were controlled for a long time, so there might be a subset that might benefit from this immunotherapy. And lastly, we also published the different manuscripts of the Stage III Resectability Consensus done by EORTC with a lot of other societies. So they have been published throughout 2025 in Lung Cancer Journal. And the final consensus definition has just been accepted for publication in the last at Respiratory Medicine. So you'll probably have the final manuscript very soon.